Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the special embryology lectures, I'm going to cover in this presentation the development of the urinary bladder. I'm Dr. Dalia Saleh, Professor and Head of Anatomy Department at Mansoura University. So in the beginning, I'm going to talk a little bit about the cloaca, its formation, division, and derivatives. And then I'm going to talk about the urinary bladder, its development, and anomalies. I'll just remind you of some of the information you have studied already in the general embryology course. This is a section in the gestational sac. You can see here the embryonic disc made of ectoderm and endoderm and mesoderm in this stage. This is the amniotic cavity, dorsal to the ectoderm, and this is the yolk sac cavity, ventral to the endoderm, and this is the cephalic end of the embryo, and this is where the heart will be formed. And with folding of the embryo, the head fold will result in formation of the four guts in this area. Here is the tail of the embryo. This is the connecting stalk, and this is the caudal end of the embryo. And the connecting stalk is a mass of mesoderm that connects the gestational sac to the rest of the chorion, and this will give us the future umbilical cord. The beginning of the formation of the cloaca, first we need the appearance of a diverticulum. It is called allantois. It is a small diverticulum or small projection, comes from the caudal end of the yolk sac and extend into the connecting stalk. Cranial to the allantois lies the cloacal membrane, and the cloacal membrane is just ectoderm and endoderm. There is no mesoderm in the middle between them, or there is no mesoderm develops between these two layers. Then, as a result of formation of the tail fold or bending of the embryo in the caudal direction, the allantois and the connecting stalk will get to the ventral aspect of the embryo. Instead of being at the tail, they will become at the ventral aspect of the embryo. And now, caudal to these structures, the cloaca is formed. And the hind gut, or the part of the yolk sac that is trapped inside the body, or the caudal end of the embryo, it's called the hind gut, will end into this cloaca. In this other view, you can see the head of the embryo, the heart region here. This is the intermediate mesoderm where the urinary system will develop, the pronephros, the mesonephros here, and this is the mesonephric duct. So this is the cloaca where the hind gut opens or ends at it, and also the two mesonephric ducts. If we enlarge this area like this, okay, so we can see the cloaca here, and the two mesonephric ducts, this one on the left side, the other one on the right side there, will end at the sides of the cloaca. Also, we can see the termination of the hind gut also terminate at the cloaca. Thus, the cloaca acts as a common end for both the GIT and the urinary system. Now, how the cloaca is divided? A septum made by the mesoderm, it is called the urorectal septum. It's a transverse ridge formed by the mesenchyme that appears between the hind gut and allantois. Again, this is the hind gut and this is the allantois, and this is the urorectal septum that appears between the two of them. It grows towards the cloacal membrane, then it fuses with it, like this. Thus, the cloaca now divides into two separate parts. Dorsally, the ano rectal canal, and ventrally the urogenital sinus. Also, the cloacal membrane divides into two parts, dorsally the anal membrane and ventrally the urogenital membrane. And the tip of the urorectal septum lies in between both of them, will form the perineal body. What are the derivatives of the cloaca? The anorectal canal will form the rectum and the upper part of the anal canal, while the primitive urogenital sinus will give rise to the bladder, the urethra, and the definitive urogenital sinus. If we talk about the development of the urinary bladder, you can notice in this picture that the entrance of the mesonephric duct into the urogenital sinus divides it into two parts. Above it lies the vesico-urethral portion of the urogenital sinus, and below it lies the definitive urogenital sinus, which will divide into pelvic part and phallic part. The bladder is formed from three different sources: from the vesico-urethral part of the primitive urogenital sinus, from the proximal part of the allantois, and from the caudal ends of the mesonephric ducts. In this diagram, we are looking at the urinary bladder from the back, and you can see the entrance of the two mesonephric ducts into the urogenital sinus, and at their caudal end emerges the ureteric bud. So with the bladder growth, the caudal parts of the mesonephric ducts will fuse within the wall of the urinary bladder. This process continues until the two tubes, or the mesonephric ducts and ureters, open separately on the posterior surface of the urinary bladder. With further growth of the urinary bladder, now the ureters open separately on the posterior wall of the urinary bladder, like I said before, and the mesonephric ducts move down to end at the prostatic part of the urethra as the ejaculatory ducts in male. The part of the ducts that fuse with the wall of the bladder forms the trigone of the urinary bladder. If you remember from pelvic lectures, the trigone lies at the posterior wall of the urinary bladder, like a triangular area between the openings of the ureter and the entrance of the ejaculatory ducts. Like this. With further bladder growth, the distal part of the allantois obliterates, and the urinary bladder now is connected to the umbilicus by the urachus. In adult, the urachus forms the median umbilical ligament. Now, what about the anomalies of the urinary bladder? Either we have an anomaly called the extrophy of the bladder. In this anomaly, there is anomaly of both the urinary bladder and the urethra. There is a deficiency in the formation of the anterior abdominal wall below the umbilicus, and the pelvic bones are widely separated from each other. The posterior wall of the urinary bladder is turned inside out because there is deficiency of the anterior abdominal wall and also deficiency in the formation of the bladder and the urethra. Other anomalies of the urinary bladder could arise if there is persistence of the allantois, and if there is no obliteration at all at the allantois, so the urachal fistula arises, and urine will be dripping out of the umbilicus. Or If the central part of the allantois persists and the two ends, proximal and distal, obliterate, so we will end up with what is called urachal cyst. If the distal part of the allantois persists while the proximal end obliterates, so we will end up with what is called urachal sinus. This is the end of my presentation, and thank you for listening.